The following is a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome, everybody. It's the Radiosurgery Show with Dr. Gil Lederman, MD. New York's only Harvard-trained, triple-board-certified radiation oncologist who brings you the latest cancer treatment news, interviewing world-renowned cancer experts, delving into special cases, and, of course, answering your questions. I'm Rob Redstone, broadcasting from the WOR studios in the heart of New York City. And now, please welcome Dr. Lederman.
Hi, it's Gil Lederman, Dr. Gil Lederman. This is the Radiosurgery Hour. We're devoted to trying to bring information to you to make your life better, healthier, longer, happier, to get better cancer treatment. We work at Radiosurgery New York, which is a private cancer treatment center at 38th and Broadway. The address is 1384 Broadway, the corner of 38th and Broadway, just between Macy's and Times Square. We have a spacious, modern cancer center. It's private, meaning we work for you, not the drug companies. The drug companies, unlike hospitals, they don't give us tens of millions of dollars to push chemo. It's not owned by surgeons to push surgery. No. We work for you. Patient by patient, we take our time, just like in the old days. We take our time, close the door, sit down, talk to you, review the documents, give you copies of your documents so you understand everything. Your questions are all answered before you leave. And we accept most insurances, Medicare, Medicaid. We have a lot of things to talk about tonight. We got several calls, actually got a lot of calls today, and one that sticks out in my mind is an 85-year-old man with lymphoma of the neck, so it'd be a stage 1 or stage 2. It's one site, and he had a biopsy. Now his doctors are pushing chemo on him, and this the recurring theme of today's calls were chemo being pushed. Well, chemo is great for some diseases, like, for example, Lance Armstrong, the man who had stage 4 testicular cancer, and many like him who years ago would have died and today live a healthy life years later, and some other diseases. But chemo is not for everyone. Even our phone number is 212-CHOICES because we believe that you, the patient, have choices. You're the president of the United States of your body, and you get to decide. Someone may be your advisor, and that's great, but ultimately you get to decide, and that's why we encourage people to have a fresh second opinion, to come in, spend some time, an hour or two, go over all your facts of your case. You might need other testing, maybe yes, maybe no. We try to get all your documents, give you copies of your documents, and then present the options for you. And you'll be surprised, there's many options. And we're going to talk about similar cases of people who have, over the years, have come to me for treatment and what's happened to them. So again, if you have questions, you can call that number 1-800-321-0710. That's the number. We're live in the WOR studio, 1-800-321-0710. And don't hesitate. Don't be bashful. The first case I want to talk about was a person who called me up, and unlike most places, we don't have answering machines and students and residents. No, if you want to talk to the doctor, you get to talk to the doctor, and that's the way it should be. So this man called up. He has stage 1 lymphoma. He's 85 years old. They're pushing him to get chemo. He does not want chemo. In fact, there's great data for stage 1, stage 2 lymphoma, curative treatment. Few treatments, focused in on that area, high likelihood of putting him into remission without the toxicity of chemotherapy. Chemotherapy, when it goes into a vein, goes from head to toe. So your hair and your toe and your brain and your heart and your liver get the same dose. And when you think about it, you're trying to really treat the cancer. You want to hit the cancer. So for this man with stage 1, stage 2 lymphoma of the neck, it may be just exactly what he wants. Now, we have another man that we're treating, an interesting man that came to us last November with a recurrent Hodgkin's disease. In fact, he didn't even know what kind of cancer he had until we got the documents. He thought he had a non-Hodgkin's lymphoma, when in fact we got the documents to show him he had a Hodgkin's lymphoma. He had treatment 15 years ago. The cancer came back in the neck. We proposed treatment in November, and then he got lost. And we tried to find him, and he was just lost. And finally, last month, he came to us, and my colleague spoke to him, and I spoke to him. I said, I don't understand. You're a young man. He's about 40, handsome, healthy, vibrant man. I said, why don't you want to be treated? It doesn't make sense. Why would you want the cancer to grow and grow? And he said to me, Doc, I don't have a place to sleep. And I can't think about getting treated until I have a place to sleep. So I got on the phone, made a call, got him a place to sleep. He's now got a place to sleep every night. And he started treatment. He had a mass the size of 2 fists in his left neck. He's had only focused beam radiation with us. And now the mass is already shrunken by 90%. He's not even done with treatment. He's happy. We're happy that he got treatment, that he's going in remission. He's had no chemo, no surgery, just focused beam treatment at Radiosurgery, New York. A treatment takes about 15 minutes. He comes in, gets a treatment, goes home. He's had no side effects, no irritation of the throat or mouth, nothing. Just shrinkage of the cancer every day. It's smaller, and I look at him every day. You can see even from across the room how the cancer was the size of 2 fists before, and now it's shrunken down to normal. Of course, we'll do tests like PET scans and other tests to prove to him and to the world that the treatment worked, and we'll continue to follow him. But that's the power of the treatment that we offer. So there's very often other options. Now, you may not hear about them. Just because you don't hear about them from your doctor doesn't mean they don't exist. And that's why I encourage people to come in, spend an hour or two. We'll close the door. We'll sit down. We'll talk eyeball to eyeball. If you need testing, we'll tell you. If you wish that, you're the boss, not us. And then you can decide which way you want to go. So again, we're live at the WOR studios, 1-800-321-0710. Call us if you wish, and if you're bashful, that's okay too. Now, I want to expand on that theme, and I'm going to talk about a woman who came to us. This woman is a 65-year-old woman. She came from Russia about 20 years ago. She's married. She has 2 children. She presented it to us March 25th. At that time, she had colon cancer spread to 3 pretty big sites in the liver and a couple smaller sites in the lung. She had chemo, and finally the patient just stopped the chemo. She couldn't take it. She had blood clots that were caused by the chemo, she believes. The chemo was poorly tolerated, and it didn't work. So she was having abdominal pain, she was having weight loss, she wasn't feeling well. She wanted to quit the chemo and come with us, and that's exactly what she did. The 3 sites were treated, 5 radiosurgery in a stereotactic frame. It's all open, not claustrophobic, painless. You come in, get a treatment, 10 minutes, 15 minutes later, go home or go to work, and she did that. And now, 3 months later, she got restaged. Restaged means we look in her body, non-invasively, to see what happened to the cancer. And the good news, and this is the good news department, all 3 masses in the liver have shrunken. So what we treated, 3 for 3, that's better. Ted Williams batted 400, which is 4 for 10. This woman we batted 3 for 3, which is 1,000. She is happy. We're happy. She had, I told you before, a couple spots in the lung. She wanted to see how we did with the big, difficult spots first, and usually I take on the most difficult areas first to prove to the patient that we can do the tough stuff. And obviously, if we can do the tough stuff, then the easy stuff is easier. So she is so happy. She brought us even a box of apple turnovers, and she wants to get that lung treated. So she has 1 nodule in the lung. It's metastatic colon cancer, stage 4. She's not having chemo, and yet her liver is in remission, and we hope after this session with the lung that she'll be in remission, and then we'll follow her on a regular basis. So that's an option. It's an option compared to all those patients who are told, you have to have chemo, it's a systemic disease, you have to have chemo for the rest of your life. No, not necessarily. There are options, there are choices, and that's why our phone number is 212-CHOICES. There's good news about low-grade gliomas. Low-grade gliomas are not sexy. We don't talk about them too much, but there's new research that shows you can extend the life of patients significantly by using chemotherapy with radiation for patients with grade 2 tumors, like grade 2 astrocytomas, oligoastrocytomas, oligodendrogliomas. Usually radiation alone has been used historically. A new study showed 6 cycles of chemotherapy consisting of PCV, which is procarbazine, lomustine, vincristine, will significantly increase survival and progression-free survival with patients that have low-grade gliomas. If you had the combined therapy, patients lived 5.5 years longer. So this is a randomized study, meaning there were 251 patients. They were randomly allocated either to single type of treatment or combined modality treatment. The patients were less than 40 years of age with subtotal resection or more than 40 with any amount of resection. And the results were published in the Journal of Clinical Oncology and then updated. And in the current analysis, with a median follow-up of almost 12 years, the median overall survival was 13 years in the combined group compared to 7.8 years in the single treatment group. So it's good news. Imagine getting a treatment where it can extend the life by 5 years compared to the usual treatment. So it's very important for those of you with low-grade gliomas or have friends or family members, or put it in the back of your memory because you may need it in the future. God forbid, but you may need it, and we want you to know this information. Again, this is Dr. Lederman from Radiosurgery New York. We're at the WOR studios. Noah and Mike are running the controls. They're taking your calls. Great people. They're running this station tonight. If you have questions, please give them a call, and I will be happy to speak with you at 800-321-0710. Now we're going to have a word from 2 new voices.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal, too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212